can you tell us a little bit about yourself and why, what led you consider this surgery?
Okay, so I'm Bernice. I'm from Singapore. Currently, I'm 28 years old. So the reason why I came to the Plus was kind of also my last resort, and I know that from my research and from some consultations with my own surgeons in Singapore, as well as some consultants here in Seoul, they recommended me to Dr. Jong because he's one of the most renowned for nose revision cases, and this will be my fourth revision. So the first rhinoplasty had an infection. My nose was also contracted, and basically a lot of complication from the first surgery. As a result, the next few cases have always been to revise the issues that were caused by that surgeon. It became not like an aesthetic, it's more of wanting me to revert to my old nose. It's been quite a difficult past 5 years for me as a result of that. So I hope that coming here, I can finally get to resolve my issues from the first rhinoplasty. The thing was, after I noticed when the cast was on already, I felt like some burning sensation. It's a bit like warm, and then I felt the cast was moving, so I thought something was going on. So I only found out when during the cast removal date, then we noticed that there is like a bump on this side, that it came out to be like a blister, so a bit like a bubble, and then initially it was a bit red, and I felt when I touch it, it feels like there is something inside. And then the first thing I noticed also, my nostril became extremely asymmetrical when my original nose was symmetrical. So I had a few issues, and it's like contracted nose as well. So everything that I wanted is not achieved during my first case. And then on that day itself, when the doctor removed my cast, he went on his trip afterwards. So I was in a way, kind of ghosted for the entire 2 weeks, and I was scrambling. I had to go to ER to check on what could be causing it, because the surgeon was telling me it could be just a blister. So 2 weeks later, I noticed there was like pus coming out, there was blood coming out, everything, and I was terrified. And then 2 weeks later, I noticed that the blister has gone, but what happened was that it caused a dent in my nose, and ever since the first, the second, the third revision, the dent has always been there. So before I came here, I went to a few other consults, and the surgeon did mention it could be deep tissue necrosis from that first surgery. That's why now the tissue here is like a bit of a bumpy, and it's like a bit dented. And then over here, there is like a very sharp bone. Also because my first surgery, the surgeon, what happened was my nose bridge, so it went up. And what happened was very terrifying. He used like a very strong, like a very long filing tool, needle, or like some kind of saw, and he went in here and he started sawing down my bridge.
Is it a normal procedure?
It's not. I don't think so. It sounds very crazy. A lot of complication from the first surgery.
Do you know what exactly go wrong? Or because they usually tell you not to eat eggs or like seafood after surgery or something.
Yeah, no, that's the thing is I don't have any allergy and any kind of medication that could have caused this. So the only reason I hear from another surgeon could be it's just that during the surgery probably wasn't clean.
So you did the first 2 surgery in Singapore?
In Singapore.
And third?
I came to Korea. The surgeon seemed to understand my case, and he told me that he can certainly fix the bumpiness of my bridge, and like the asymmetrical nostril will be a bit difficult, but he can try and everything. But as soon as the cast came off, you notice the bumps became even more prominent. So he said that it was difficult because when he opened up, it seems like it's not an issue with my structure. It's like more towards the surface. So I'm not exactly sure because he said it could be a cartilage that was loose, and then it's like there. Yeah, so I not very sure what's causing it also.
You have any concern for future surgery?
I didn't know. Because I really want and wish for this to be my last. It has to be my final and my last surgery because it honestly, I think there is a lot of other consequences I had to bear as a result of a mistake from a surgeon. I wish to live my life normally. Yeah. I always had symmetrical nostril from birth, and as a result of the surgery, it feels I became very conscious because it's very asymmetrical, especially from certain angles, and that to me is also one of the very first sign that someone has undergone multiple surgeries and or like botched surgeries. And then secondly would be the scar, because now there is a very deep dented scar at my base as a result of the multiple opening from the rhinoplasties, and the scarring and the skin tissue I feel like is quite obvious from the surgery, and I just wish to have a much natural lower bridge, like a lower slope bridge, and then it's like more evened out as well, and then the last will be more aesthetic, right? It will just be like a shorter nose from the front and like a higher tilted tip. That's it. Yeah.
I'm curious, like, why did you come to Korea after what you did in Singapore?
Because I honestly I felt that my trust was a bit broken because I went to 2 different surgeons in Singapore. Yeah, and it was the second surgeon when I went back to him after the surgery. He recommended me as well that I have to go to a renowned surgeon in Korea and not the typical, like hospital types clinics. So from there I did more research, and as well as when I had a lot of consults via online or during a separate visit when I came to Korea, I think a lot of consultants actually recommended me to the Plus.
Is there any major factors that you choose the Plus?
One of them definitely is the before and after cases that I saw online, and I saw a few also kind of, I think, publication written by Dr. John like Nose, and I realized he's actually very renowned in this area. And when I saw the before and after, I saw a lot of the before cases look similar to mine, with like asymmetrical nostrils, contracted nose, very difficult reconstruction cases because of failed surgeries. And also from a surgeon in Singapore that he apparently in Singapore is also a bit renowned. He's quite well known, and he recommended me here. He said it's like his mentor. I'll be undergoing the surgery tomorrow, and I'll be staying for about 10 to 11 days post the surgery. Yeah.
After tomorrow, we will see you next week. Thank you for the interview. I'll see you next week.
Yeah. Thank you.